OHSS, or ovarian hyperstimulation syndrome, is a scary and serious side effect of IVF, but it doesn't have to be. I'm Dr. Lora Shahine. I'm a reproductive endocrinologist helping people build families for almost 20 years with IVF, and we have learned so much about prevention and treatment of OHSS. But you need to learn this as a patient. If you are getting ready to go through IVF, you need to be able to have a very thorough conversation with your doctor about risks. And then as you're going through the cycle, you need to know if you're having warning signs of it, and you need to know how to advocate for your care. That's what this video is about. I have another video here that's all about the definition, physiology, causes of OHSS. And so please go to that for more information. This is for the patients getting ready for IVF, and they're trying to figure out, am I at risk? What's going to happen? And how do I advocate for my care? So let's get started. In this video, we're going to go over 4 main topics. Number 1, you're going to learn if you are at risk for OHSS. Number 2, we're going to go over questions to ask your doctor before you start your IVF cycle. Number 3, we're going to go over warning signs during your IVF cycle for OHSS. And number 4, we're going to talk about all about recovery and what to expect, how to decrease your risk of OHSS, and warning signs during that time. So to start, who is at risk of OHSS? Well, everyone honestly is at risk. I mean, the whole point of IVF is to stimulate the ovaries, to recruit eggs, to enlarge, to get more eggs out of a cycle than you would naturally, because we know that not every egg is perfect and not every egg is going to turn into a beautiful embryo and a live birth. But there are some people that are at risk of developing more severe OHSS and really should understand that risk and talk to their doctor about a way to prevent it. So those people fall into 5 categories. Number 1, younger age. One study showed that people less than 34 years old had a higher risk of OHSS. Number 2, lower body weight. So a BMI less than 23 is associated with increased risk of OHSS. Number 3, a higher ovarian reserve, like a higher egg supply. If you have an AMH that's over 5, if you have an antral follicle count that's over 24, you're at higher risk of developing OHSS in your IVF cycle. Number 4, patients with PCOS or polycystic ovarian syndrome are at a higher risk of OHSS. And finally, number 5, in your cycle, if you have a really good cycle or overstimulating during the cycle, you're at risk of developing OHSS. And that includes having estrogen levels over 3,500 picograms per milliliter, having more than 20 mature follicles developing by the time of the trigger shot, and at retrieval, having more than 15 eggs retrieved puts you at higher risk of developing OHSS. Second topic I want to go over are questions that you should ask your doctor before you start IVF, because I know there's a lot to learn. You're trying to understand the medications, where you're going to, get the shots, how to take the shots. You're thinking about genetic screening of embryos. I've got a great video here on that could help with that very confusing topic. You've got a lot on your mind, but something that you should ask about is OHSS. So I've got a list of questions here for you. So there are about 8 questions, but I think they're important because this is your cycle, your body, and you should be aware. So question number 1, am I at risk of OHSS? So I've gone over what the American Society of Reproductive Medicine has said, what research has said, but your doctor knows you best. So ask your doctor about your personal risk. Number 2, if you are at risk, ask what actions are being taken to decrease your risk of developing OHSS, since you are at higher risk. Number 3, ask what protocol you're doing and why that was selected. Number 4, ask about your trigger shot, which trigger shot, the dose of the trigger shot. Question number 5, do you recommend a fresh embryo transfer or a frozen embryo transfer for me? If someone gets pregnant with a fresh embryo transfer and they're already starting to develop OHSS, their symptoms can get much worse and they can have a very difficult first trimester. Number 6, ask, if I do develop symptoms of OHSS, what are we going to do? How are we going to adjust the cycle or the plan or the medications? Number 7, how do I get my questions answered if I'm developing symptoms of OHSS even after the retrieval? Is there a doctor on call? Can I reach out to the nurse? Can I come into the clinic if I'm not feeling well? What would happen if I do get OHSS? And finally, number 8, What do I do after the retrieval and recovery? What suggestions do you have? And again, how do I get in touch with somebody if I'm having issues at that time in my IVF cycle? All right, topic number 3, the warning signs of OHSS. What do you look for during your cycle to say, oh my gosh, I think I might be developing this? And, how do you talk to your team about it? There's 3 things to look for during the cycle, kind of signs of OHSS. Number 1, feeling bloated and a lot of pelvic discomfort. Everybody can feel a little bit of that through their IVF cycle, but if it is significant, talk to your team. Number 2, free fluid around the ovaries. So when you're doing an ultrasound, talk to the person who's doing the ultrasound and ask them what they're seeing. How many follicles? How are my ovaries doing? And if you have free fluid, like fluid that's collecting in the pelvis around the uterus, around the ovaries, that can be a warning sign of OHSS. And number 3, estrogen levels during your cycle. It's normal for estrogen levels to go up as the eggs are maturing and the follicles are developing. It's actually a really great sign of a good cycle. But if they're developing very rapidly or getting really high, that could be a warning sign of OHSS. So if you're showing signs of OHSS, there are things that your team and your doctor can do in the cycle. There's pros and cons for everything, but you can ask about 4 things. Number 1, ask about adjusting the dose of the medication. There's pros and cons, but maybe if you decrease the dose, it'll decrease the symptoms. Number 2, talk about your embryo transfer plans and goals. If you're planning a fresh embryo transfer and you're developing OHSS, you might want to talk to your doctor about switching to a frozen embryo transfer, giving your body time to recover from this stimulation before you actually try to get pregnant. Number 3, talk about the trigger medication that you're planning to use as you're getting closer to the trigger. The dose that you're going to use, are there alternatives that could decrease your risk of OHSS? And number 4, talk about taking other medications. ASRM lists cabergoline as an option to take around the time of retrieval and up to 5 days after the retrieval. It's a dopamine agonist that acts on your pituitary gland that can decrease your risk of OHSS symptoms after the retrieval. Again, pros and cons to all these interventions, but it's something that you can talk about. And there are things that you can do at home to decrease your risk of symptoms worsening, helping symptoms improve, helping recovery. So let me talk you through these things. It's mainly recommendations about rest and exercise, and then intake of electrolytes and protein. So as far as rest and activity level, you don't want to do strenuous exercise. You are already essentially dehydrated in your bloodstream, so you don't want to do vigorous exercise. It's going to dehydrate you more. You do want to move around. You don't want to just lie in bed all day, because moving around actually helps with circulation and getting the fluids moving. But when you do rest, keeping your feet elevated can also help with circulation and decrease some of the swelling that you're feeling and kind of bloating that you're feeling. And for protein and electrolyte intake, this is something that is dramatically changed the recovery for patients in my own practice. It's not something that's listed in the ASRM guidelines for OHSS prevention from 2016, but it's something that I've been doing since I was a fellow at Stanford, quite honestly. Increasing protein and electrolyte intake in addition to fluids to hydrate, like just water to hydrate, actually is a better way to keep hydrated. If you're just taking in water, your body doesn't use it as well unless you mix that water with electrolytes like sodium and potassium and increased protein. I think about the sodium, the potassium, the protein kind of pulling fluid from your tissues into your bloodstream so it can take it to your kidneys so you can pee it out. And so I know it seems funny because you feel swollen, and when you feel swollen and bloated, you're typically told, oh, decrease your sodium intake because sodium makes you feel bloated. But this is a different process in your body. And so more sodium, more potassium, more protein will actually help you recover faster. I talk to my patients about trying to drink at least 60 to 80 ounces of water a day and mixing that with electrolytes. And so there's a lot of ways you can do that. You can have Gatorade, which has sodium and potassium. I don't love the sugar in Gatorade, but you can do that. You can do Noon tablets. You can do Pedialyte. My personal favorite is Element. It's LMNT. I have worked with them before. They did not sponsor this video. I just really love their product and what they do. It is a ton of sodium. It's a ton of potassium, and it also has magnesium. And the magnesium helps with one of the other side effects of IVF, which is constipation. And so all of those things in conjunction with water and protein, you can get protein from either, foods that you intake like chicken soup or miso soup if you're a vegetarian, because they're really salty and they've got lots of protein. You can also get protein powder. So trying to get a lot of protein can help you with your recovery. You don't want to have more than 1 milligram per pound of protein in a day. So if you're 150 pounds, don't try to have more than 150 grams of protein. But I talk to my patients about trying to get at least 100 to 120 20 grams of protein. You can get these little scoops that have about 20 or 30 grams in it, put it in the liquid that also has the electrolytes, and just sip on that throughout the day. And that is so much more effective for your recovery than just drinking water. So electrolytes, protein, and then avoid liquids that are going to dehydrate you, like caffeines and alcohol. Okay, topic number 4, recovering from the egg retrieval. We all kind of focus on this goal, like getting to the egg retrieval, and people often say, oh, I'm so glad I'm having my egg retrieval. I'm so ready to feel better. And I have to sort of say, oh, I'm so sorry. But you actually, maybe you'll feel better, but a lot of times people are still having that fluid shift. They still have the high levels of hormones. They still have the physiologic process of OHSS that's going on. And so they don't feel great immediately. And sometimes people can even feel worse after the egg retrieval. Part of it is if they're using HCG for the trigger shot, that stays in your system for 7 up to 10 days. And it's that HCG that's causing the capillaries in your blood vessels to be leaky and all that fluid to get into your pelvis and abdomen. So that's why the protein electrolytes help get that fluid back into your bloodstream to help take it to your kidney and perfuse other organs. It helps you really rehydrate. And I wish it was like a light switch, but it is not. And so if you're doing the electrolytes and the protein, keep doing it after the egg retrieval. It's only going to help with your recovery better. Continue the minimal to moderate exercise and movement, but avoid strenuous exercise. And here are some warning signs that you should look for and really call your clinic if it's happening to you. There's 6 things to really look for. Number 1, excessive weight gain. If you gain more than 3 pounds in one day, call your clinic. That is a lot of fluid retention. Number 2, severe abdominal pain. Of course, people can have discomfort, but if you are really in pain, the over-the-counter medication or whatever was given to you for recovery is not working, call your clinic. Number 3, nausea and vomiting that is so intense you just can't keep liquids down, call your clinic. Number 4, decreased or absent urine output, or really, really dark urine. Those are signs of significant dehydration. Number 5, shortness of breath. And finally, number 6, significant dizziness. The shortness of breath can sometimes be from just like your ovaries and kind of a fluid pushing up on your diaphragm, that muscle that's right underneath the lungs. So you feel like you can't really take a big deep breath. It can also be from pleural effusions, fluid around the lungs. And the dizziness can just be another sign of very significant dehydration. So if you're in recovery and you develop OHSS, I go into full detail of treatment in my other video, but important things are to stay in touch with the clinic and ask lots of questions. Be seen if you are having any of these significant findings and just not recovering well. Treatment can include anti-nausea medicine. It can include IV fluids to help you hydrate. It can include medication for constipation. Sometimes people are so dehydrated, they actually are at a higher risk of blood clots. And sometimes people need anticoagulation medication or blood thinners. If someone has significant fluid retention in their belly and pelvis, sometimes they benefit from a paracentesis, which is an actual draining of that fluid. We don't do this very often, but in extreme cases, when somebody has that much fluid and they get it drained, they just feel so much better so quickly. It can be a significant turnaround in symptoms. And finally, if you really need it, if you can't keep fluids down, if you're in significant pain, if you need it, you can be hospitalized and really taken care of until you're feeling better. That is an extreme. I cannot remember the last time that we hospitalized someone in my practice, but before we knew all that we did about choosing different protocols and prevention and knowing who was at risk and adjusting and adding medication, switching triggers, before we knew all about the sodium, potassium, and protein, 20 years ago, 15 years ago, it was not uncommon to have a patient in the hospital recovering from their IVF cycle. And I am so glad it is not that way today. I hope you learned something from this video. I hope that you gained knowledge that you can take to your team and to your doctor. And so that the both of you can all work together as a team for prevention and treatment and recovery so that you don't develop OHSS, or if you do, you have a mild recovery and you have an incredible supportive team. Like this video if you learned something, comment with questions that you have. Be sure and subscribe to this channel so you get my weekly videos. And as always, stick around for more learning.